through the afternoon. To other news now, and tomorrow afternoon, President Cyril Ramaphosa is due to sign the NHI bill into law. It's being described as a public ceremony in Tshwane. The bill's been sitting on his desk for several months. Earlier this year, he said he was looking for his pen to sign it. As you know, huge opposition to the bill from organised business, the private healthcare sector and doctors. They say the plan to allow anyone to use a private hospital will wreck the healthcare sector. There are, of course, many people who support the bill. Khulekani Mathe is the CEO designate at Business Unity South Africa. Khulekani, good afternoon to you. You oppose the bill. Do you believe the president is doing the wrong thing by signing it into law without making any changes?
Good afternoon, Stephen, to you and the viewers of Newzroom Africa. We have said in the past that and asked the president to send the bill back to Parliament for reconsideration. The reason for that, Stephen, is that there have been many concerns raised by ourselves as organized business, and we will get into the detail of why, but also by healthcare professionals, as you've said, political parties, unions, some unions, and academics. So clearly, there's something that needs re-looking about the bill. And so there is a reason in our constitution that the idea of consultation is provided for in making legislation. In this particular case, despite all of the comments that were put forward, it seems that they were not considered and there was simply a rush to pass the bill. And we appealed to the president to not sign it and send it back so that we fulfill the constitutional requirement of actually considering the views of stakeholders. The president has opted, as we understand from the statement, to sign the bill into law. And we think that that is a real concern.
OK, but Khulekani, I mean, there are millions of people who would support this bill. You talk about consultation. If you had to have a referendum, I think you'd probably find that most people support it for the simple fact that it would improve the quality of the healthcare that they get. They see the private hospitals. They have to go past them on the way to a government hospital. They know what happens in government hospitals. I think if you had to do public consultation, I think it would go against you.
And partly because we think that not full information is made available to everybody. So if I were to ask you, I won't, but if I would ask anybody, how is the NHI going to be funded? The government has not come out clean on how the NHI is going to be funded. So once you put the details on the table about how much it would cost and where the funding would come from, you might then come to a different conclusion. We simply feel that this has been rushed without really considering thoroughly a number of important elements that would make it work. Let me be absolutely clear that we support the goal of universal health coverage, i.e., everybody being able to access good quality health care. What we are concerned about is that this bill is actually not achieving that, even though the rhetoric suggests that it is. The reality is that it is not achieving that because, on the one hand, it is unaffordable. The numbers that we've seen suggest that it will cost upwards of 200 billion rand. Where will the money come from? It might result in having to raise taxes. And if you just look at the composition of our taxes, we certainly don't see the scope for raising the taxes that would be required to fund this. So if you start to really take the full picture, you start to wonder whether this is in fact workable. And our view is that in its current form, the bill is not workable. It also does not, in other words, it excludes the private sector, in particular private medical schemes, from being participants in provision of healthcare and payment for healthcare services. And again, in an environment where we have limited resources, the idea of exclusion seems to be really, it's mind-boggling. Why? When we, in other areas like transport, we're working with government and we're pulling resources together because there's a good realization that we need each other. We need all of the resources of the country to be pulled together. In this very important policy and sector, you take a policy and a piece of legislation that exclude other players. That is mind-boggling.
Khulekani, are you going to join the queue to go to court immediately after the bill is signed into law?
It's not so much a question of joining the queue, Stephen. We have said in the past that we will obviously weigh our options. The president is hopefully not just going to sign, but he will also make announcements about which aspects of the bill will come into effect, at which point, and what other processes will unfold. If we believe that all of that really still does not answer some of the concerns that we have indicated in the past that we will exercise our options of taking the matter legally.
Khulekani Mathe, thank you. CEO Designate of Business Unity South Africa, really do appreciate the time. All right, well, that, of course, happening tomorrow at 2 o'clock at the Union Buildings in Tshwane. In a moment,